So they,
Yes, ma'am. And
so they,
that would happen in June?
yeah, it started in June. So they were starting like a temporary placement where they were gonna put me in a respite house until they put services in place. But then the next week, they said that my needs were not high enough. So I think they're just stealing money.
Yes, ma'am, I understand. And just confirm, you believe that they are also charging Medicaid?
I'm not 100% sure if they're charging Medicaid. I thought because I was in the partnership program, it goes through them, like the Medicaid payments and the Medicare payments. They're my insurance company, and I get Medicaid and Medicare, so I don't know how that connects. I just know that they get money for me monthly from Medicare or Medicaid, most likely both, and they're keeping the money.
Yes, ma'am. And what, are you a recipient of Parts A and B of Medicare, or what Medicare parts do you receive?
Hold on, let me ask chat because I don't know. I'm in long-term care. I don't know what that includes. It says, since you're in Mychoice Wisconsin partnership, your plan is Medicare, Medicaid, dual eligible managed care program. This means Mychoice handles both your Medicaid and your Medicare benefits in one plan. A, B, and D.
Yes, ma'am. And you stated that you get a monthly stipend for just medical expenses
I did not say those words, so
and care expenses.
I don't know what that means. I just said that they get money from me monthly and they manage it. And I have not received any of the care that I was supposed to get. Like through Medicaid or Medicare, they're supposed to like provide me transportation, and they're supposed to provide me an in-home caregiver per my doctor's letters saying that I'm not safe at home without a caregiver, and they haven't provided one.
Yes, ma'am. So they are supposed to be offering you transportation services and care or in-home care services. Do you know if they are not providing any other services?
They're
or
not.
what other services do you know?
There's a lot of stuff that they're pretty much not providing the services that I'm supposed to get in home. Like every service that is supposed to be through like the partnership. Hold on, let me get exact stuff whether or not I could just ask chat what they're supposed to be helping me with. Oh, it's just telling me the same thing again. They're refusing to coordinate with my doctor. No conferences, communication between providers. They're denying respite, in-home supports, protective care, supervision, failing to provide transportation consistently, ignoring recommendations related to my autism, TBI, memory, and other disabilities, no help with long-term care planning, not providing access to records and case notes. The neglect and constant denial of services have led to severe stress, Health decline. I don't think that's the questions you were asking. They're not helping me get the medically necessary services that they're paid to provide.
Yes, ma'am, I understand. And do you know typically how much a month you're supposed to be receiving for these services?
I don't know anything because they won't give me any records. They won't even give me my care plan. So at least $3,000. I don't know how much, but because of the care that I'm required, it has to be over $3,000.
Yes, ma'am. And for Mychoice Wisconsin Partnership, do you have a phone number for them?
Like the nurse number, or just like any general, like which type of number?
Yes, ma'am. So a general number, if you can provide that.
Okay, 1 second. (608-218-0462) that's the member rights number. I can get you the regular number. Hold on a second. The regular number is 1-800-963-0035. 1-800-963-0035.
And just confirm, the first phone number that you gave me was 608-218-0462.
Yeah, that's the member's rights number.
And do you have a mailing address for them or a physical address?
The administration office is 10201 West Innovation Drive, Suite 100. And then it's Wauwatosa, Wisconsin, Wauwatosa, 53226.
And just confirm, you said that was 10201 West Innovation Drive, Suite 100?
10201 West Innovation Drive, Suite 100, 10201.
And can you also provide me an address for yourself?
It's 113 Kennedy Heights, Madison, Wisconsin, 53704. Kennedy Heights, Madison, Wisconsin, 53704.
stated that was 113 Kennedy Heights?
Yes.
Yes, ma'am. And is there an apartment number, or is
No.
it just that address line?
It's just the address.
Yes, ma'am. And would you also have your Medicare number?
No, I don't have it on me. Maybe I can
Yes,
find.
ma'am.
Maybe I can find it in my phone somewhere, but I don't think I have it. Hold on. Is it the number that's on the Medicare health insurance card?
Yes, ma'am. That should be the number on a Blue Light card.
Okay, it's 9MY8 EW6 CN28.
And do you also have your Medicaid number?
That's the only. I don't know any other number.
That's okay, ma'am, if you can't provide it. Can you provide me your date of birth?
9/25/1988.
Yes, ma'am. And can you also provide me an email?
B as in boy, RESHA 23@gmail.com.
Yes, ma'am. And just confirm, do you have any other information in regards to this situation?
No, I think I said everything already.
Yes, ma'am. And would you happen to know any names of individuals involved?
Yes. Jennifer Hyman. She is the person who's responsible for all the cares part. She's an RN. I think her last name is like HEIMMAN. And then the case manager who decides the other half name is TAYJA. Last name is Braun, BRUAN.
Yes, ma'am. And just to confirm, do you mind spelling that last name again for me?
BRUAN. Braun. I think that's how you spell Braun. BRUAN.
Yes, ma'am. And you stated that this person was your case manager.
Yeah,
what are they specifically responsible for?
They're responsible for making sure that I get the services that I need. Anytime I try to talk to somebody else in the program, they refer me back to them. The nurse and the social worker.
Yes, ma'am. I know earlier you stated that instead of giving you an in-home nurse, they sent you to another facility or a care home. What is the name?
I didn't say that. I said that they told me that they would get me emergency respite and send me to a home, which is what I need right now. But then they changed their minds, and then they kept me in my home without any support, is what I said.
Yes, ma'am. I do apologize.
Yes, I pretty much just said they're not providing me with any services. So that means in-house, out-house. There's no services, so I'm not in any type of facility. I'm at home alone without support against doctor's orders.
Yes, ma'am. And just confirm, a medical professional confirmed that you needed 24-hour assistance and care, and they did not provide it?
Correct. It's medically necessary that I have someone giving me support in my home. That's the letter my doctor wrote them. They're supposed to coordinate care with my doctor, but they didn't. So they didn't actually verbally tell them because they won't coordinate care with my doctor, which is part of their program requirement, is to coordinate care with the doctor.
Yes, ma'am. And what is the name for your doctor?
My doctor name is Eleanor Meisner.
Yes, ma'am. And do you mind repeating her last name or spelling her last name for me?
Misner. I have two documented primary caregivers, so they have both of them. I have also Dr. Fowl, Fohl.
Yes, ma'am. And what is his last name?
That's her last name is Dr. Fowl.
Yes, ma'am. And do you know his first name?
Her first name is Renee.
And to confirm, do you know what clinics they work for?
They
work at?
Fowl work at an SSM clinic. And Renee works for a UW clinic. UW Yahara.
And do you mind spelling that for me?
Yahara. Yahara.
And just confirm which doctor works there?
Dr. Meisner.
And what clinic does Dr. Renee work at?
She work at SSM. I don't really know the exact information other than she works for SSM. I don't know like the address or anything. I can't remember those things.
And do you have the address of UW Yahara?
No, I don't, but if you Google it, you can find it.
Yes, ma'am, I understand.
How many more?
Yes, ma'am, and just quickly.
How many more questions is there? I have an appointment right now, and I have to check in soon.
Yes, ma'am. So I do believe that is all the information I have. Just give me 1 second to review it, just to make sure I have everything.
Okay.
ma'am. So I do believe that is all information I need to file this report.
Okay, can you go over what you have in the summary?
Yes, ma'am. So you're reporting on Mychoice Wisconsin partnership, and you're reporting that they are denying you services, and they're not coordinating with your doctor, and they're not providing you a 24-hour caregiver that is medically necessary.
Okay, they're not providing me any caregiver, so.
Yes, ma'am. And you're also reporting Jennifer Hyman, who is a registered nurse who is supposed to be responsible for your care, and a Miss Bond, who is your case manager, who is also not providing support.
Did you just say Tasia? Does it matter?
No, ma'am. So
Does it even matter
Miss Braun?
if? Yeah, Braun. Her name is Tasia.
Yes, ma'am. I also have that in the report.
Oh, okay. Okay, thank you.
Yes, ma'am. Of course. And I do hope you have a good rest of your day.
You too. Bye.
Bye.
I had a new